to start with. And then the womb has the wall of it, the mouth of it, which we call the cervix here, and then the inside, okay? And so it is designed by the Almighty Creator that
amazing.
there is a special type of cell inside that lines the inside of the womb. And that should exclusively be found there, okay? Now, in endometriosis, by some reason, those cells find themselves outside the womb. And that is the problem, okay? So that cell is called endometrial tissue, endometrium. The inside of the uterus is called the endometrium. So the cells there make up the endometrial tissue. So if such endometrial tissue gets found outside the inside of the... Sorry. Like you see on top there, those red dots. That is the occurrence of the endometrial tissue outside the inner lining of the uterus. And that becomes what we call endometriosis.
Okay. Sorry, I'll get you water in a minute.
Yes, that'll be helpful.
So, so in simple terms, endometriosis happens when
the cells that are supposed to be inside the womb get outside.
Okay. What would make cell that's supposed to be sitting in the womb get outside?
Yeah, that's really what the problem is. So what brings it about? So what actually brings it about is not fully yet understood. I know. But we have found certain risk factors, okay? Now, there are some scientific theories that are saying that sometimes when a woman is menstruating, the menstrual flow comes from the inside of the uterus through the cervix, which is the opening here, and then through the vagina, and then it flows out. Some research has said that some of what is coming out, a little bit also flows out through the tube into...
Backwards.
Backwards. Thank you. Okay? And so that is one of the theories. So because it's able to go back out, then some of it can jump onto the tube. So mind you, endometriosis can happen on the tube, on the outside of the uterus, on the ovary, even on the intestine, or just inside the woman's lower abdomen, what we call the pelvis, internally.
On the intestines?
Yes, on the intestine.
So these are living cells, they walk?
They are living cells, they move there.
They move, right.
Sometimes, very rarely though, they also get into the blood and they can come all the way into the lungs, in the chest, okay? Now, so here's what happens. Every month, the woman gets the menstruation, which is shedding of blood from inside the uterus, okay? From those cells we call the endometrial cells. So when the time of the month comes, wherever those cells are, they will bleed, okay? So endometriosis, when the cells are on top of the uterus, on the ovary, in the lungs, or in your lower abdomen, when you're having your flow, you're bleeding in all those places.
So it behaves like a menstrual period?
Yes, okay? And that is what causes terrible pain.
What makes it painful? Is it some sort of inflammation? Does it hit your walls?
There's a lot of inflammation that goes because blood is at where it's not supposed to be. So the blood irritates the tissues and causes a lot of pain.
Okay.
Very occasionally, some of the nodules will travel and be found around the belly button. So somebody's having the period, that 3, 4, 5, 6 days, some bleeding is coming from here.
When I hear needles, my mind runs chasing after the term cancer.
Well, yeah, so it behaves pretty much like it, just that it is not malignant.
Okay. Okay.
It's not malignant.
Okay.
It wouldn't kill, doesn't cause those other things that cancers do cause.
Okay.
But it is notoriously devastating.
So if a woman is in her period and she's experiencing severe pain.
Severe pain. So 2 women having severe menstrual cramps, one of them most likely has endometriosis.
And may not even know.
A lot of them do not know.
Okay. If you have endometriosis and you're in your period, do you have longer bleeding periods?
Not necessarily, but women who have longer periods are more likely to have endometriosis.
Okay,
it's
because
a risk
that's a result
factor.
of something, blood that's...
Because you're bleeding for longer.
Okay.
So that tendency of some of the blood to go back is higher compared to if you just had it for 3, 4, 5 days.
Okay.
So longer, now we're talking about more than 7 days.
Is this common in Ghana?
So it's very common. You know, this disease has been known to medical science for about 2,000-3,000 years ago.
You don't say. How old are women, though?
I know. Women have been since the days of Adam, isn't it? So what it is about 160 years ago, it became well documented. So we got to know really what it is to some extent. Okay. So what it means is that for women having certain risk factors, the tendency to get the endometriosis is higher.
Right.
Okay.
Right.
And so some of these are a woman who begins having their menstruation a bit earlier.
So we moved into the risk factors, right?
Yes.
Right. A bit
Earlier than, if your menses started earlier than 12 years, your risk of developing endometriosis is slightly higher than if the periods began a bit later. You know.
And too late too?
Too late in this case would be protective against endometriosis.
Okay.
But may have
something else.
its other issues, yeah.
Okay. Okay.
Then, like I said, when they bleed excessively, more than 7 days, it's a risk factor. Okay. And some people are just born with that genetic predisposition. Your mom had it, and so you are likely to have it.
Oh, Lord.
You see what I mean? And then one of the things that we advise against, which has also been found to be a risk factor, is when people have sexual intercourse during their menses. Okay, so that is also a risk factor. So, I mean, we generally would discourage that because of the risk of pelvic infection and all other things. But beyond that, it's also increased the risk of endometriosis.
Wow. So you might look out for a woman who's got her period quite earlier.
Yeah.
I mean, surely you shouldn't be having sex in your period. You're so prone to infections, really. And I want to remember some of the risk factors again.
The prolonged
years period. And genetically, sadly, maybe if your mother had it, then you probably would end up with it.
Yeah.
Now, let's look at the symptoms.
So, like we said, the most bothersome one is the pain. Pain, menstrual pains, okay? Because, and how the pain comes about is because there is tissue outside the uterus, which is bleeding. So that blood would irritate wherever it is. Very occasionally, some people have the endometriotic nodules in the chest.
Yeah.
So during the time of the menses, she's cramping, intractable pain, and yet also bleeding inside the chest. So she's getting breathless and coughing.
What does the bleeding that have, though is rare, where does the blood that oozes out in the lungs, where does it go? Does it still travel back for you to bring it up?
It accumulates there.
Oh my God.
It accumulates there. So it's a matter of how big the tissue is. If it's just a small tissue, it bleeds, oozes for the number of days you're in your period, wherever it is, and you suffer the symptoms of chest pain, difficulty in breathing. Sometimes then, as the period ends, the body absorbs it. Okay, other times, it gets so much, it accumulates. We need to put a tube in the chest to drain it. Occasionally, we've had to do open surgery, open up the chest to remove the tissue in order to prevent, it's cyclical. So every month, the woman goes through that, every month, okay? Now, it also causes this type of menstrual pain that would begin a few days to weeks before the flow would come, okay? And it also just causes what we call chronic pelvic pain. The woman always has low abdominal pain, almost all the time. Sometimes the pain comes during sexual intercourse. So because during sex, there's a little bit of shaking in the pelvis. So the tissues are being traumatized. There may be some bruising, and that causes pain. So pain during sexual intercourse can be one of two things. Either the pain is just in the vagina, or the woman feels it deep down in the lower abdomen. So the pain from endometriosis typically is in the lower abdomen.
A lot more in the lower abdomen.
More, yeah, during sex.
How do you diagnose it if a person walked into the facility and showed you all the symptoms?
So, I mean, typically there would be a history of, most commonly, menstrual pain, what we call dysmenorrhea. So the menstrual pains, difficulty controlling it is what will bring the patient in. But that said, a lot of women also have endometriosis that would not show any symptoms. So we find it sometimes when we're doing surgery and we see, oh, she actually does have endometriosis. Some people, endometriosis is the cause of inability to conceive. So in about 50% of women who are trying to conceive and having difficulty, endometriosis is a likely cause. Because you can imagine that those tissues affecting the tube would cause inflammation. It's like a sore inside, and as it heals, it forms a scar. And so that scar causes the tube to get blocked. And so once the tube is blocked, the egg cannot travel through, the sperm cannot travel through to meet the egg. And so there'll be difficulty conceiving. The presence of the endometriotic tissue in the ovary as well makes the ovary unable to do the function of releasing the eggs. Okay. Occasionally, like we talk about when we're talking about complications, the tissue can actually be there for so long that every month is bleeding, so the blood is accumulating, and it forms a kind of a huge ovarian cyst with blood inside. Okay, and you know when blood stays for long, it gets darker. So that, and we call it endometrioma. I have a photo of that to show you. So that
becomes... You have names for everything. Endometriosis.
Yes.
Endometrioma.
Endometrioma.
Oh.
So that has like the cyst with blood inside. When you open it up, it looks like a chocolate drink. So we call it a chocolate cyst right there.
Okay.
You see the normal ovary is to the left.
This one?
This is a normal ovary there, looking whitish. Okay. And this one, you see that purplish round balloon thing there is the endometrioma. This is endometriosis. So every month there's a bit of bleeding there. And so the blood has accumulated and formed a balloon. Okay.
And so every month, can the woman still release the ovaries from that side and have her period normally?
Good question. So the whole part of that ovary which is occupied will not be functional. So that is how it affects fertility. Okay. So you are left with, depending on this one. And once this woman has this, chances are that the other parts of the pelvis would be affected. The tubes may not be good. Okay, and then the presence of long-standing inflammation as a result of the presence of these endometriotic cells makes the ovaries a bit inefficient, and so the egg quality also gets compromised to some extent.
Doc, at what point would you say this is an emergency?
It becomes an emergency. So that cyst you see there, which is it's called endometrioma, or commonly called chocolate cyst.
Okay.
Because when you burst that open, you see what looks like a chocolate drink.
And it's all dark blood.
Yes, dark blood, like typical chocolate drink, okay? So you can imagine one of the things that can happen to that is it could burst. Because if it's there for so long, it's getting bigger and bigger, it stretches and it bursts. So that is an emergency that would have to open up to deal with.
Is it possible that as it's growing bigger, that part where it is, you get...
Yes, you feel a bulge there. Yes, sometimes, So sometimes the woman comes with a bulge there, with a history of cyclical menstrual pain, and then difficulty conceiving, or severe pain throughout the cycle, whether she's menstruating or ovulating or not.
Are you able to do just physical examination and you can tell what you have to do?
Yes. So to various extent, depending on the size, sometimes when the woman comes and we just examine, we're able to feel, there's a lump there. Of course, you'd have had a history of dysmenorrhea and menstrual pain, and then nausea, vomiting, feeling bloated during your cycles, or diarrhea, or pain when you go to toilet around the time of your menses, or pain when you pee around the time of your menses. So some of these may be telling me, okay, she's probably having endometriosis. Then when we examine, depending on how big it is, we'll be able to feel it. Then apart from that,
is this how you
yes, so we do the internal examination, where the doctor or the caregivers, gloved fingers go through the birth canal, and then we examine to see if we can feel any of those nodules around the pelvis. Some of them we're able to feel, but the tiny ones you may not be able to. And then we do an ultrasound scan.
So when this has happened, is there room for anything called fibroids again?
Definitely. So many things can be going on at the same time.
At the same time.
Yes, and indeed. Commonly, you see the woman who's battling fibroids also has some endometriosis going on. Just makes the suffering a lot more worse.
Okay.
You know. So then we do the ultrasound scan, either the one we do through the abdomen, we just put a probe on your tummy and we're able to see it, or if we are not sure, we do the internal one like you see here, where the transducer is the probe that is covered neatly with a lubricant, and it goes through the birth canal.
Okay.
Then it shows what is going on inside on the screen for us to see, okay, the uterus is here, the ovaries
is it painful?
Here. No, it's not painful. It's not painful.
So
it's just,
the patient's eye is...
Oh yeah, this is just a simple thing. Your eyes are open. I tell you that you feel some slight discomfort as we push it in, and then in some places I show you what we are seeing inside. You also actually come along and see it on the screen, and you can tell, okay, so this is my uterus, this is my ovary, this is where the problem is. And then in some cases we use a similar approach to treat it. For instance, if it has formed a cyst that we don't want to open up, we attach a special needle to that same probe, and then it goes in and then to empty that chocolate content, and that relieves you.
If after that treatment, are you still likely, since we are unable to tell how it even happens, are you still likely to get the same thing again?
So sometimes we're able to win at curing it completely, sometimes. And how that works is we do surgery, and the surgery can be either open surgery or what we call laparoscopic surgery, where a keyhole surgery will make about 3 holes on your tummy, put these tubes in that have got, 2 have got cameras and 1 has got a light, and then another, we pass scissors through, they're able to go. Whilst looking on the screen, we haven't opened up, but these probes are in your tummy, and we look on the screen.
I'm so tired talking to you.
It shouldn't be.
I'm so tired listening.
Yeah.
Okay, I'm going to be kind to you. I'm going to be opening the phone lines. I hardly get Dr. And so you want to ask all the questions, please call us on 0302 211 693 or 94. 0302 211 693 or 94. I promise I'm going to give you the telephone number of which you can reach him, so that if you're unable to call me, you can still get to talk to him later after the show. Okay.
So that is what we call laparoscopic or keyhole surgery. Okay. I mean, it's a surgical procedure. We'll put you to sleep so you don't feel pain, and we do that. So at that surgery, we're able to remove as much of the endometriotic tissues wherever they are, and then that solves your problem. Okay. Sometimes it is so extensive that we are not able to. And one of the things it causes is the inflammation makes all the tissues to get stuck together.
Oh.
You know, so the whole pelvis is kind of frozen. So the tubes are caught up, it becomes sticky, everything is all, so you go in and it's difficult to find where your tubes are, where the ovaries are. It's difficult. So very difficult surgery. Requires a lot of expertise.
Okay.
Otherwise, there's a tendency for damage to other organs.
Right.
You know, unintentionally.
Let's talk to Abigail. Hello, Abigail.
Hi, good morning.
Good morning.
Oh, okay. Please, I would like to ask Doctor. I actually gave birth 6 months ago, and then hence I've been feeling some movement in my lower abdomen. It feels like there's something moving down there. I went to do scan, and I was told it's an accumulated fat. And I've been trying to work out to burn that fat, but I just don't know how to go about it. Can you please say something about that?
Okay, keep watching because I'll share his telephone number. You know what Doc will say? You have to visit the facility again.
Okay, all right.
All
Thank
right.
you very much.
You're welcome, Abigail.
Yeah.
Accumulated fat?
Well, so if something is moving in the lower abdomen, either there is some growth, commonly fibroid, or some variances. These are the common things that would give that sensation.
Yeah.
The fat is pretty much in the abdominal wall. It doesn't cause movement inside.
Okay.
So there's definitely a place for a second opinion. So if she can get to see another gynae to have another assessment, just so we're sure.
Okay. Please call 0302-211-693 or 94. Let's talk to, hi, my namesake, MFA.
Yes, good morning.
Good morning, MFA. Please go on.
Please, I've been feeling some pain in my abdomen, even if I'm not in my menses.
How old are you?
I'm 19.
Okay. Have you been to the hospital yet?
Please, you said.
Have you been to the hospital yet and listened to me on your phone? You haven't? Okay, I'm going to hand you over to doctor.
Okay.
Right. So MFI is 19. She falls within the age group because this condition affects women between 15 to 44.
Okay.
But a lot more common, 25 to 35. A lot more common. So, but yeah, she's 19, so she's still a candidate. It may not be
That.
endometriosis. It could actually also be. So the way to tell her, she needs to be thoroughly assessed. So don't just assume your menstrual cramp is normal. You know how our people think every woman you have to feel menstrual cramp. That makes you a
It's so
woman.
painful.
Yeah. So to the extent that it is unbearable, making you take some medication for relief, you need to get checked and let's see what the cause of your menstrual cramps are, so we can deal with it.
Okay, Doc, let's go to Upper East.
Okay.
Let's talk to Richard. Hi, Richard.
Hello.
Good morning.
MFA.
Good morning. Good morning, Richard. Please go on.
Yes, please. I want to ask doctor if having constant lower back pain is a symptom of endometriosis and if it has any connection to pelvic inflammatory disease. Because my wife was diagnosed of that recently.
Thank you for the clarity. I was going to ask if you're asking for yourself. Okay, I'll take note of that. Let's talk to Salamatu as well. Hi, Salah.
Yes, good morning.
Good morning.
Please, I want to ask Doc, I've given birth to, for 2.5 years ago. And I've been trying to conceive, but still I don't find it easy, though I didn't go to the hospital. But I want to know what is the cause of when maybe after having sex, then it comes out, even if you don't have immediately after the sex.
I'm so sorry, Salah. I think I lost you a few times. Can you please go over your question?
I said,
Right.
what is the cause of maybe having sex with your partner, and then after the sex, everything, the sperm come out immediately. I don't know why. So I was thinking maybe that was why I'm not considering.
Okay, thank you. Question is not related to endometriosis?
Well, she's having difficulty conceiving, so
yeah.
partially, yes.
Okay. All right. Thank you so much, Salamatu. We'll address it for you. So the first one is back pain.
Yeah, lower back pain.
Lower back pain,
Yeah.
and as to whether it's related to pelvic inflammatory disease.
Yeah. So it's a good question because in some cases, just based on how severe endometriosis is, the pain could actually be felt at the lower back. Okay, and these symptoms of lower abdominal pain, menstrual pain, also sometimes present in a woman with pelvic inflammatory disease. And the thing about the pelvic inflammatory disease is, in most cases, it will make you feel sick. You may have a bit of temperature, you may have nausea, vomiting, and also pain during sex. So that's why I said you can't be sure what is the cause of your menstrual pain. And so you need to get assessed. And through the assessment, do some blood work, do a pelvic ultrasound scan. Then we're able to tell, okay, yours is from endometriosis or yours is from pelvic inflammatory disease.
You touch briefly on what pelvic inflammatory disease is. We'll touch on it when we come back.
Very
Then we'll address Salah's issue. But I've got a caller from, hello. Hi, SNM.
Hello.
Hi.
Good
Yes, ma'am.
morning.
Good morning. You're calling from Machimota.
Yes, please.
Great. Please go on.
Okay, please. I had an ultrasound, and the results came that I'm pregnant, and there is a left ovarian catalyst. I don't know if that's a left ovarian. So I just want to know how that comes by, and would it have any effect on the child?
Okay. Yes, ma'am.
How many weeks pregnant are you?
Right now I'm 9 weeks,
Okay.
but at the time it was 7 weeks.
Okay, good.
Okay.
Thank you.
All right.
Thank you, Asnam.
Yes. So we'll quickly talk about this.
Okay.
So when you're pregnant, you get pregnant because you ovulate. Ovulation means that a little bit of a balloon forms here in the ovary that contains the egg, and it releases the egg, which gets fertilized. Okay. And so that balloon would persist for a couple of weeks to support the pregnancy, because it produces hormones that support the pregnancy. And so if you do a scan in the first few weeks of pregnancy, you may see that ovarian cyst. But there's a size limit to which it should not attain. If it gets bigger than that, we are worried that it may burst inside, or it may twist and become an emergency for which we have to do open surgery. So depending on how big or small it is normal or it is abnormal.
Okay.
Okay.
The scan is able to tell how big it is.
Yes,
or
we
not?
measure it. We measure it. So your doctor who requested a scan will be able to interpret to say, yeah, yours is a normal one. We call it a corpus luteal cyst.
Okay.
Or it is a pathological ovarian cyst for which some intervention would be necessary.
Okay. I have a question after that, but let me pick my last caller. Hello.
Hello.
Hi, Agnes. Good morning.
Good morning.
Right.
I don't know, like for my cycle, when it comes, like it will come this month, but it will take about 3 months before it will come again. So I don't know whether it is part of endometriosis.
Thank you so much, Agnes. Dog, endometriosis is a dissemblable. Right.
Yes, okay. So that's another thing we need to talk about sometime. Menstrual disorders in general.
Okay.
So we can talk about what constitutes a normal cycle, what's abnormal.
Okay. I'll check your schedule on that.
Right, yes, good. So the other thing she's talking about is some hormonal problem which affects the menses. So that typically the patient who has this problem will have some small cysts in the ovary. We call it polycystic ovarian syndrome.
That's the polycystic.
Okay. So the presence of those small cysts would make it difficult for the woman to ovulate in majority of cases. And because you don't ovulate 2, 3, 4, 5 months, you don't get your period. Then either you may ovulate, or the thickening inside the womb just gets overboard and it starts bleeding.
Okay.
And typically they skip the menses for 2, 3, 4, 5, 6. Somebody can go for up to a year. And then she'll bleed heavily for so long, we may even have to use medications to stop it.
Okay.
It's commonly a hormonal problem, and that woman would also be a bit more hairy, because those small cysts would make the ovary to produce a bit more of male hormones. I know you are not that hairy.
Okay.
You know, so the woman will be a bit more hairy, and they tend to have a bit of acne, and then most of them, when they put on a bit of weight, then the problem comes. But if they manage to shed the weight, the cycles get restored. So stuff like that. It's not necessarily related to endometriosis, but it's a common gynecological disorder.
I promise you we will talk about the menstrual disorder and everything that goes into it. Let's deal with Salah's issue.
Yes, Salah's issue.
How even are you able to see that semen is coming out? How do you know that's it?
Okay, so you're able to tell. So what happens really is, so during sexual intercourse, this is the uterus. It's up there in the lower abdomen. And then here would be like the birth canal, the vagina. So it is expected that the semen is released in the vagina, okay? The semen is the fluid that the man releases, and it contains what we call the sperm. The sperms are the living things, like tadpoles, inside the fluid called semen. So when it is released, these little tiny tadpoles are able to find their way to enter the whole of the cervix, and then there's a chemical attraction. If you ovulated here, the sperms are attracted to travel through the tube to where the egg is. Okay, the same way I'm able to tell that you're a woman and I'll come to you. You attract me. So the
job
egg
starts from the semen.
from deep inside, yes.
Right.
So the sperm is able to tell that, okay, this is where the egg is. Let me move there. And so the living parts in most cases of the sperm, of the semen, are able to travel and go to do what they have to do. So the fluid may flow back out, okay? But because some people too do have tubal blockage, which is the reason why they are not conceiving, and at the same time, after sex, they think that everything is coming out, it brings an issue of, is it like something is not going to do what it has to do, or is it just that the sperm is so weak? Because the truth sometimes also is that the sperm cells are dead in the semen.
Okay.
So that is male factor infertility.
Okay.
The sperm is released all right, but it's just a lot of fluid with no living cells inside to go do the fertilization.
Okay.
And that would come out because...
So if the semen is strong and everything is okay, and you just need one semen to go and fertilize, the rest, where do they go?
The rest will hang around, and then they'll die after about 3 days.
Does the body absorb the liquid, the rest of the liquid?
Most of them will come out, as part of what may appear like a vaginal discharge.
A photo of how the endometriosis, the cells in the tube.
Yeah.
So it can block. Can the cell be that big to block the ovary from traveling?
Yes. So let me teach you two terms that you have confused. Semen is the fluid that is released.
Okay.
The sperm is the living cell inside the semen.
Right.
Okay.
Right.
Good. Now you're being a good student.
Yes, thank you.
So the sperm is what we expect to travel to go meet the egg. The egg is released from the ovary.
Okay.
Okay. Now, so even though the sperm is very microscopic, you can't see with your naked eye, the endometriosis causes a lot of inflammation, which ultimately results in blockage. So the sperm cannot reach the egg. The egg cannot travel down.
Clearly you can't have
yes.
a child, yeah.
So somebody having difficulty conceiving, the causes can be actually also from the man. In fact, in a matter of about 50%, the problem is from the man. Yes. The sperm is weak, the count is below what is expected, or they are not able to move as they are expected to be able to reach the egg within the 2-3 days that the egg is available. Because the egg, once released, does not stay forever.
Right. Right. I'll take your final words. This conversation can go on and on, but I'll take your final words, and then I look at the schedule and we talk about the follow-up questions that have come later on.
Right, yeah. So we've been talking about endometriosis, a very bothersome major gynecological disorder. And the leading symptom it would present is menstrual pain, pain during sexual intercourse, and bloating, and also sometimes pain when you go to toilet during the time of your menses. It is very common. Up to 1 in every 10 women do have that condition. Yes, out of every 10 women. And about half of women who have painful menses are suffering from endometriosis. Half of women with infertility are suffering from endometriosis. So you don't sit at home and say, oh, painful menses is a woman's thing. Come forward, let's get it checked so we can deal with it, so you don't have to go through the complications.
Because you've been kind with your information, I'll be kind. I'll give you a bag of Royal Aroma rice when you're going home. Yes.
Bring it back again tomorrow.
Okay. All right, so I will give you a number that you can call Dr. Promise Sefogah on. He's the best person to contact. He's a consultant, obstetrician, a gynecologist, a mouthful, I'm sorry, this morning. Also from GH Health Connect. And so you can call him on 030263 1880 0303026 13880. Doc, shall I say the telephone number itself as well? 05. Is that your private number? So they don't wake you up. Okay, so all right. So please, you can also send him an email on promise@hotmail.com. PROMEES hotmail.com. Thank you so much, Dr. Promise Sefogah. It's a pleasure. I want to have a conversation again.
Pleasure.
So, Jay is coming up. A copy is also here. Bits and bytes. Stay with us.